Comparison with 1918 flu. A comparison of excess deaths in New York City during the beginning of the COVID-19 outbreak with excess deaths from the peak of the 1918 H1N1 influenza outbreak in the city found that the two pandemics are in the same ballpark, said study author Jeremy Samuel Faust, MD, an emergency physician at Brigham and Women's Hospital in Boston, Massachusetts. Faust and colleagues took mortality data for the peak months of each pandemic in New York City and compared the number of deaths beyond what would normally be expected for that period based on prior years. The mortality rate per 100,000 people in a month was 287.17 in the 1918 influenza pandemic, and 202.08 in the spring COVID-19 surge. But because death rates have dropped by half over the last century with medical advances, the relative increase in excess deaths during the COVID-19 outbreak was substantially greater than the rate during the 1918 pandemic. Secondary transmission. The risk for secondary transmission is less than 4% overall among close contacts of people diagnosed with COVID-19 and varies by settings and disease severity, according to a report on contact tracing in Guangzhou, China. The risk for secondary infection for 3,410 close contacts of 391 COVID-19 index cases was highest for household contacts, at 10%, followed by those exposed in healthcare settings, at 1%, and on public transportation, at 0.1%. Repurposed drug news. Accumulating observational data suggests that metformin use in patients with type 2 diabetes might reduce the risk for death from COVID-19, but the randomized trials needed to prove this is unlikely to be carried out, according to experts. In one recent study that has not yet been peer-reviewed, researchers found that, among more than 600 patients with diabetes and COVID-19, the use of metformin was associated with a nearly 70% reduction in mortality after adjustment for multiple confounders. However, metformin users tend to do better in many different settings with respect to many different outcomes, one expert said. To me, it is still unclear whether metformin is truly a miracle drug or whether it is simply used more often among people who are healthier and who do not have contraindications to its use. In related news, physicians from University College London proposed in the Lancet Rheumatology that B-cell depletion with rituximab might benefit certain patients with severe COVID-19, targeting chronic adaptive host immune responses or inflammatory lung complications persisting beyond acute infection. They called for more research into the possibility. Comparison with 1918 flu. A comparison of excess deaths in New York City during the beginning of the COVID-19 outbreak with excess deaths from the peak of the 1918 H1N1 influenza outbreak in the city found that the two pandemics are in the same ballpark, said study author Jeremy Samuel Faust, MD, an emergency physician at Brigham and Women's Hospital in Boston, Massachusetts. Faust and colleagues took mortality